It's a pleasure to introduce our next speaker, our second speaker of the morning, who is also a membership of the Workshop Planning Committee, Jessica Fanzo. Jessica is the Bloomberg Distinguished Associate Professor of Global Food and Agricultural Policy and Ethics at the Nietzsche School of Advanced International Studies, the Berman Institute of Bioethics, and the Bloomberg School of Public Health at Johns Hopkins University. She is recognized nationally and globally for her work in food security, sustainable diets, and nutrition, including current service as co-chair of the Global Nutrition Report. Jess will speak on implications and relevance of sustainable diets internationally. It's all about the context.
Hey, good morning, everybody. It's really great to see so many friends and incredible experts in the audience. So I'm going to give a bit of inject the international context, building on what Adam had spoken about so eloquently in the 4 pillars of sustainable diets, of how we think of it currently, but also give a little bit of the political context of what all this evidence means. So I think all of you know diets are now one of the leading risk factors of morbidity and mortality. The global burden of disease, which we have Ashkan here, right in the front row, who's going to talk more intimately about this. But we know that diets now, while important for human health, can also be a dietary or a risk factor for disease burden, which is a huge issue. And when we start to inject the sustainability piece into diets, it really has a long, tangled history, these relationships. There was work by Joan Gusau, who a lot of you might know from Columbia University, who published a book in the 1970s around eco-nutrition or ecological nutrition. And there was always this talk, exactly what Adam said, around environment and human health, but very little discussion around economics and other factors that are so important for sustainable diets. But this topic is not new. We're all sitting in this room talking about it again, and it comes in and out of fashion. It comes in and out of fashion, just like international development topics. We see a lot now of diets, sustainability being discussed in large global reports, the global panel of agriculture and food systems for nutrition did a foresight report on this, where they talk a lot about what are healthy diets, how do we get access to healthy diets and sustainability issues. We have the Global Nutrition Report that tries to bring in elements of sustainability, probably not enough. And the Committee on Food Security, the UN Committee on Food Security that's hosted by FAO, had a nutrition and food systems report this year where there was sustainability pieces. So it's a topic. The nutrition community globally is discussing it. And the more evidence we garner that informs policymakers, the better off we are. And I'll come back to that in a little bit. Adam put up this definition in all of its beautiful vagueness. And I've put it up again because while we all can agree with this, how do you actually take this definition and put it into practice? If a policymaker is to read this definition, what is she going to do about this in her country? So turning this definition into a feasible reality is a real challenge, particularly for those living in low and middle income contexts and countries. Why is that? Well, policymakers are dealing with massive inequities everywhere. We see it in the United States, but we're seeing this big divide in inequities. And because of that, they have to prioritize, they have to evaluate what trade-offs they have to look at the resources they have domestically and internationally and make some hard decisions. Consumers have to navigate this. It's very difficult at the moment to understand what is sustainable, what's not sustainable, what do they believe, what don't they believe. But they also take into context taste, preference, convenience, what's practical, what's affordable for them. That also fulfills their own demands and desires. And the private sector has to answer to that demand while at the same time ensuring that there's a market for that. There's a business case to be made. So there's lots of these stakeholders that we need to be thinking about in actually turning this definition into a reality. In the low and middle income context setting, many of the diets consumed are actually quite sustainable. They eat food, not that much, and mostly plants, as Michael Pollan had said. Well, other plants, maybe Adam, the other plants. In high and middle income countries, as urbanization happens, meat consumption in general is rising. There's exceptions to that. Whereas in low income countries, populations really can't afford animal source foods. I mean, you talk to a rural Kenyan woman and she eats goat meat maybe once a month. But we know that this is very important for growth, particularly young child growth. A lot of low-income countries consume insects, very common in many cultures. And the plant-based diet is the diet. So these diets are quite sustainable, but are they fulfilling the nutritional needs of those communities living in low-income contexts? And the decisions that we make in high-income countries will impact us, but they will impact the low-income countries and those who are vulnerable so much more. Our choices about what we consume will impact those people who have the inability to adapt and deal with climate change. So our choices matter. Interestingly, this paper came out in Lancet Global Health showing you that in sub-Saharan Africa, the diets are the healthiest. And a lot of people disagreed with this. We think of other places having very healthy diets, but they argued that sub-Saharan Africa, particularly West Africans, have a very healthy diet. And this is a very controversial piece of data that came out, because we know that in places like sub-Saharan Africa, malnutrition burdens are incredibly high, stunting remains very high, as well as micronutrient deficiencies. There's inequities in meat consumption, some by choice, some not by choice. India, obviously, the low consumers of animal source foods, whereas places like the United States, can I go back? People like the United States and Brazil tend to consume a lot more flesh, as we would say. And this is supply chain data, so hopefully Ashkan will be showing actual dietary consumption data. And we know also that in much of the world, young children don't get access to enough foods. This diagram here is showing you in children ages 6 to 23 months of age. The pink is showing you children that get no animal source foods a day. And this is the world number here, so almost half. And the light yellow are children that get one animal source food a day. So why do we care about that? Well, in many places, young children, even if they're eating legumes and lots of leafy greens, they don't get access to enough iron and zinc in their diet. So these are figures from K. Dewey in Bangladesh, Ethiopia, and Vietnam. And even if you have a lot of dietary diversity of plant-based foods, it's very hard to meet your iron and zinc needs, two very critical micronutrients for cognition and growth. So this is a conundrum. This whole meat topic is a conundrum of those who are consuming way too much and those who don't get enough. Where do we create the balance? Where do we create the equity? How do we deal with that when you get into self-justice and autonomy issues about don't tell me I can't eat my hamburger and drive my SUV every day? These are big issues that we need to grapple with if we're going to talk about sustainability. And we know that the world is going through rapid transitions. Food systems are transforming. They're not static. And with that, we see urbanization, we see a globalized food system. And as people move out of famines, which we're still seeing famines, unfortunately, coming back, and move to subsistence agriculture, people are going to urban centers. And with that, their profile of the epidemiology of their health outcomes change from high maternal and child mortality and stunting to obesity and NCDs. Their diets are changing, their physical activities changing, they have more disposable income to spend on other things. Most of the world sits here in pattern 4. We have about 1 billion people who go to bed hungry. We have 1 billion people who ride their bike to work every day and get their cheese at the cheesemonger in Brooklyn and have a farm on the weekends. The elite. But about 5 billion people are sitting in this transition. A lot of what Adam described, eating up more processed foods, commuting long hours to work to an urban place. This is the world. There's a lot of people sitting in that food system, and they are going to shape and change it. And this is a conundrum for us. And right now, that 5 billion is not so sustainable for a lot of you who have traveled around the world. And we're seeing rapid changes. I work a lot in Myanmar, and the last 2 years, KFC has become the hippest restaurant you can go to. Why? It taps into desire. It's pretty tasty. There's queues around 5 blocks in Yangon to go to the KFC. This is changing. Ghana, KFCs everywhere. A lot of industry is coming into the low and middle income countries and shaping these food systems for better and for worse. And we see this growing demand for meat, and I can't emphasize that enough. And this meat, it's not only just the increased consumption, obviously not in all places like India and Ethiopia where they practice fasting, which is a vegetarian fasting, but the meat is moving all over the world. And the feed to feed meat is moving all over the world. So this whole system needs to be rethought. We also have disjointed policies. What the food supply can bear and what agriculture policies lay out almost always is a mismatch to dietary guidelines. Dietary guidelines are done somewhat in isolation without having agronomists in the room or environmental scientists in the room, and big recommendations are made towards what people should eat every day, but that doesn't mean the food supply can answer to that. So there needs to be a real thought on what agriculture can deliver in achieving nutrition. And we also see across the board, and this graph is from Steve Wiggins at ODI. He was showing that if everyone followed the U.S. Dietary Guideline, shown in the light green for dairy, this is the world's food supply for dairy in the dark green. We would outstrip it on a yearly basis per capita. At the same time, this was work done at CIAT showing that agriculture systems are becoming more homogenized and they're growing less crops over time to answer to a lot of the demand. And policymakers are constantly dealing with these trade-offs. They're dealing with agriculture strategies and then dietary guidelines. They're dealing with changing consumer demand, feeding other parts of the world. And they themselves have to deal with trade-offs of what they grow and what it means for them economically. Palm oil is the big one that people talk about. If you go to Malaysia or Indonesia and you talk to the Minister of Agriculture and say to him, stop growing palm oil, he'll look at you like you have 3 heads. Obviously, palm oil not great on land use changes and biodiversity loss, not great for health, but incredible for economic growth. Trade-offs. Grass-fed beef, methane gas production. Hopefully Marco and others can talk about, Dave Tillman can talk about this in more detail. The answer to that is not clear yet to me. Olive oil, should we be growing it in California or should we keep it in the Mediterranean? These questions around health, environment, and economic trade-offs, policymakers are having to do every day. Trade. Big issue for policymakers. We often think trade is bad. It's bringing in those energy-dense foods that Adam talked about into the far reaches of the world. We did a study that was published recently and showed that, but if you don't have trade, you actually can put more people into micronutrient deficiencies as well. So there's always positives and negatives. There's always these trade-offs that we have to consider. Trade is not always all bad. So what are some of the evidence gaps? Well, we know we need more evidence. Adam called for this because there are clear gaps. But we need to understand what constitutes a sustainable diet in different populations, in different contexts, and how do you measure this in different contexts? I was in Nepal not that long ago, and someone said to me, well, if I had a plate in Nepal, what would a sustainable diet look like on that plate? I don't know. I mean, these are hard questions, but this is what consumers want to know. So we need to better characterize the determinants of diets. And Adam went into this a bit, looking at a suite of indicators. We need guidance of what it would mean economically for all value chain actors. If you're asking industry to become more sustainable, what does that mean for them economically to do that? And we need policy analysis of how can you better integrate sustainability issues and create policy coherence. So Adam put this up. This was some work that we did together with Dave Gustafson and others, looking at a suite of indicators and then plotting those to different countries, and do they fulfill these different elements of sustainable diets? Is this helpful to a policymaker? Will she know what to do if she's sitting in Senegal and she's looking at this diagram? Probably not. Criticizing my own work. They're thinking more about value chains and how do you get food from A to B to C? And how do you inject sustainability and nutrition and economic growth into this value chain? We need to start thinking like industry, we need to start thinking like policymakers, as opposed to giving them a suite of indicators and dashboards and saying, look what the data is showing you. I don't think that resonates a lot with policymakers. We did an analysis, this is an awful thing, this diagram, sorry, looking at all these different elements of sustainable diets, and we looked in Nepal at 3 different strategies: the nutrition plan, the biodiversity plan, and their agriculture development strategy. And we looked to see across those 3 strategies, did they capture these elements of sustainability? And did they actually have an action plan to fulfill those? And when we looked across some of the elements around environment, sociocultural, economic, and nutrition, the agriculture strategy actually had the most sustainability elements, and the nutrition strategy had very few. What does this say? We need to get the global nutrition community thinking about sustainability. Agriculture thinks about it much more because it's their bread and butter. We in the nutrition field feels very far from us. So while all of us in this room have drinking the Kool-Aid, there's a lot of nutritionists who don't think at all about sustainability issues and where our food is coming from. I'm going to end on just a little bit of policy making. We think about evidence-based policy making. It's really important, right? We hope that all policy making is rooted in solid evidence. And there's policy making cycles where you do an assessment, you develop a budget, you implement, you monitor that, and then you readjust. But there is really no policy cycle in which we inject evidence at the point of decision making. It's a messy process, it's unpredictable, and I'm learning this in my sabbatical. I'm at FAO on sabbatical. It's a complex system in which evidence may resonate or it may not. And this is a hard reality of those who work in research and evidence to come to grips with. So I like this quote: the good news is that evidence can matter. The bad news is that it often does not. And when policymakers are making decisions, they're looking at evidence, but they're looking at judgment, they're looking at lobby groups, they're looking at habits and tradition, they're looking at values that country holds. And while we can think about opinion-based policy as being the norm, we know that evidence-based policy is improving. Policymakers are savvy. But we need to figure out how we better influence policy making. So we need to come to grips with this. So while, Adam, I agree with you, we need to have more evidence, we need to think about what we do with that evidence. Publishing in the Lancet, Nature, it's wonderful. It's a great feeling. But policymakers don't read that. So how do we take that? And writing a policy brief is not enough either, which we all have in our grants. So we need to reject two romantic notions: that policymakers think like us as scientists, and that there's an identifiable point of decision at which experts can contribute to the evidence that makes an impact. We just need to come to grips with that. What we're dealing with is bounded realities. They've got limited time, limited information, they need to make decisions quickly, and they don't like when you say, we need more research. They really don't like that, right? So we need to think about the rational ways that policymakers can make decisions. And I just want us to be thinking about that all day if we really want to move the needle on this. Now we have the SDGs, very important. The global world the world has rallied around these global goals. Sustainability is threaded throughout them. So it's a moment in time to reinvigorate this conversation. All of the member states of the United Nations are meeting next year on a progress report of the SDGs to see where they're at in New York. And it's an important moment to see how far we've come on this area of sustainable diets. And this is my last slide. I don't know if all of you saw this. It was in the New York Times this morning. And it's a long piece, a very long piece that they published around the idea that we knew a few decades ago, the science was clear. It was laid out well to policymakers that climate change was happening, and they had solutions of how to do it. This was 3 decades ago. Climate change went out of fashion, and it came back into fashion. And so this is my call to all of you, that maybe we know enough. There's been a lot published on sustainable diets, and we need to be thinking about ensuring that this kind of thing doesn't happen again, where we knew what to do 30 years ago, and policymakers just didn't act on it. So something for us to think about throughout the day as we talk about the evidence. Oh, these are just some starters. Be thinking policy, be thinking about programs, consumers, and research, all levels. Great, thank you.